Okay, let's dive straight in. Today on the deep dive, we're taking a close look at this really interesting conversation. Joe Rogan and Jillian Michaels back on April 30th, 2025.
Yeah, it was a long one, nearly 3 hours. We've kind of distilled it down, looking at recaps and summaries.
Exactly. And our mission here is, well, to pull out the stuff that's actually useful for you, the big insights, maybe some surprising facts, things that might genuinely help you think about your own health and well-being, trying to cut through the noise.
And it's a good mix, source-wise. Rogan, obviously known for these deep, sometimes controversial dives. And then Jillian Michaels, huge name in fitness, nutrition background, very direct.
Very direct, yeah. She's got that Biggest Loser background, her own podcast now, certified nutritionist too.
Right. So the source is basically key moments from that Joe Rogan Experience episode, number 2313, recorded in Austin. And they covered a lot.
They really did. Personal health stuff, critiques of the whole industry, longevity, all of it.
And these kinds of conversations, they often bring up things you don't hear in, like the mainstream health advice channels.
Yeah.
Can really make you question things.
Absolutely. So yeah, get ready for maybe some eye-openers. There's a personal bit from Michaels about her family that's pretty interesting.
Hmm.
Debunking fitness myths always needed. A pretty sharp look at big pharma.
Oh, yeah.
Lessons from those super long-lived populations, the blue zones. Even how belief systems might play a role in health.
That's a fascinating angle.
And, just reflections on the whole personal health journey thing. So where should we start? That piece about her parents seemed like a real attention grabber.
Yeah, let's start there. It was quite the reveal. She mentioned quite openly that she has her parents, her mom and her stepdad on TRT, testosterone replacement therapy, and peptides too.
Wow, okay. So not something you hear every day. What was the context there?
Well, it kind of kicked off a whole discussion about hormone optimization, especially once people get over 40.
Right, when things naturally start to decline a bit.
Exactly. And they talked about the potential benefits, like more strength, more energy, just a better overall quality of life.
So it wasn't just about, like, bulking up or looking younger.
No, not at all. Michael's really stressed that. She framed it more as enhancing vitality, feeling more alive, not just aesthetics. It was about feeling better.
Did they mention any, like, evidence or studies around this?
She did touch on that. Michael's referenced some studies suggesting TRT can have benefits for aging individuals. I think she threw out a figure, something like a possible 20% increase in muscle mass in some cases.
Okay, so not just feeling better, but actual physiological changes.
Potentially, yeah. And Rogan, he chimed in too. He's obviously covered this stuff before.
Right, he often talks about TRT and similar things.
Yeah, he mentioned hearing from his listeners, sharing anecdotal stuff about, positive experiences they've had, better energy, improved mood, that kind of thing.
So it's this mix of personal testimony, the science bit, and listener feedback. Interesting.
Definitely highlights it's a growing area of interest, maybe moving beyond just the hardcore biohacker crowd.
Okay. So from hormones, they kind of shifted gears, didn't they? Started tackling some common fitness ideas?
Oh, yeah. This was classic Jillian Michaels territory, I think.
Yeah.
They really took aim at some widespread fitness myths.
Like what? What specifically?
Well, she was really strong on the idea that there's no single right diet for everyone. Said one diet fits all is, quote, total nonsense.
Which makes sense, intuitively. We're all different.
Exactly her point.
Yeah.
She was basically saying, listen, your body's unique. You got to find what works for you. Less about dogma, more about personalization.
So true. We get bombarded with eat this, not that. What myths did they specifically debunk?
Things like, the old carbs are evil mantra, or that endless cardio is the only path to fitness.
The classics.
Right. She argued for balance, focusing on whole foods, real foods, rather than getting caught up in, like, the latest keto or paleo craze, unless it genuinely works for you.
And did she connect that to, like, the science of it? Inflammation or anything?
Yeah, she mentioned studies linking highly processed foods to inflammation in the body. Her advice was pretty simple. Cut the junk. Feel better. Basic, but often overlooked.
It's amazing how much better you can feel just doing that. Rogan mentioned his listeners seeing benefits from cutting sugar, right?
They did, yeah. Shared anecdotes about people reducing sugar intake and noticing big positive changes.
So the big takeaway there is tune into your own body. Don't just blindly follow influencers.
Pretty much. Be your own health detective, essentially. Pay attention to how different foods and exercises make you feel.
Okay. Now, the tone shifted a bit, got more critical when they started talking about the pharmaceutical industry.
It definitely did. This was an area where Michaels had some strong opinion.
What was her main point?
She basically argued that the industry's model is often about creating customers, not cures. That the profit incentive can lead to focusing on managing symptoms with ongoing medication rather than finding root causes or actual cures.
Hmm, that's a heavy critique. Did Rogan push back or agree?
He largely seemed to agree. He brought up the opioid crisis as a kind of stark example, suggesting that's a case where profit motives arguably led to devastating public health consequences.
Yeah, that's hard to argue with.
They sort of explored this uncomfortable idea.
Hmm.
Is the industry sometimes selling solutions to problems it helped create, even indirectly?
Wow. And the money involved is just staggering. Did they mention figures?
Rogan dropped the number, something like $1.2 trillion spent just on pharmaceuticals in the U.S. in 2023 alone.
1.2 trillion. That's a lot of incentive.
It really puts the scale of it into perspective.
So what was Michaels's advice to people listening, hearing this critique?
Essentially, be critical. Seek out evidence-based information. Don't just rely on the drug ads you see on TV. Do your own research, understand the data, make informed choices.
Be an active participant, not just a passive recipient of healthcare.
Exactly.
Okay, so after that critical look, they moved into something more, well, inspiring, I guess. The blue zones.
Ah, yes. The blue zones. Always a fascinating topic. These places around the world where people live exceptionally long, healthy lives. Like lots of centenarians.
Right. Okinawa, Sardinia, places like that. What was the angle Michaels and Rogan took?
Michaels pointed out that these populations generally aren't relying on dozens of pills. Their longevity seems linked to other factors.
Like, what? What are those factors?
Things like diet, typically whole foods, often plant-based, strong community ties, real social connection, and, interestingly, a connection with nature, regular natural movement.
It sounds so simple in a way, but maybe hard to replicate in our modern lives.
That's exactly what they talked about. Can we take lessons from the blue zones and apply them elsewhere? Michael seemed to think the core principles are transferable.
So what are those core principles again?
Eat real food. Move your body daily. Doesn't have to be intense workouts, just consistent movement. And actively foster your social connections. Really nurture those relationships.
That social connection piece seems increasingly important. Did she mention any data on that?
She did cite some research suggesting communities with strong social ties have a lower mortality risk. I think the figure was around 15% lower. It's a significant health factor.
Wow. It's not just nice to have, it actually impacts lifespan.
Seems so. They also touched on the flip side, the downsides of modern life, being constantly plugged in, staring at screens.
Yeah, the need to disconnect sometimes. For our sanity, if nothing else.
Exactly, for mental and physical health, finding that balance.
Okay, this next point was one that really made me pause. The idea that belief systems can impact health.
Yeah, that was thought-provoking. Michaels put forward the idea that having a belief system, maybe spirituality, maybe something else, can positively influence your health.
How so? What was the proposed link?
She suggested that believing in something bigger than yourself can provide a sense of purpose. And purpose, she argued, seems linked to a longer life.
Purpose. Interesting. Does she back that up with anything?
She mentioned some studies, again, correlation, not necessarily causation, but still interesting, that found lower mortality rates, maybe around 25% lower, among people who identified as religious.
Okay. But what might be the mechanism there? Is it the belief itself or something else?
Well, she suggested it could be partly the community aspect often found in religious groups, that social support system we just talked about.
Ah, okay. So it connects back to community.
It could, but the conversation broadened out a bit, didn't it, to the whole mind-body connection.
Right. Rogan chimed in saying something like, purpose keeps you going.
Exactly. And Michaels clarified, it's not just about religious faith. Any strong sense of purpose, whatever gives your life meaning, could potentially offer similar benefits. Finding your why, essentially.
That feels important. Having a reason to get up in the morning.
It really does.
All right, so towards the end, things got a bit more personal. Jillian Michaels talked about her own health journey.
Yeah, she shared some insights. She mentioned, and this ties back to the start, that things like peptides diet tweaks saved me, suggesting she's actively using some of these, let's call them alternative or optimizing strategies herself.
Okay. So she practices what she preaches, or at least explores it. When Rogan asked about her go-to strategies, what did she land on?
She really emphasized the fundamentals, eating whole foods that came up again, consistent strength training, and crucially, looking after her mental well-being. For her, those are the keys to balance.
Makes sense. Physical and mental together. Did she elaborate more on the peptides she mentioned?
A little bit. She talked about using them for recovery, kind of like hitting a reset button for her body after intense periods, so giving a more concrete example of how she uses them.
And the overall vibe of that part of the discussion, was it about quick fixes?
No, not at all. It was more about resilience, the long game. Michaels described health as a marathon, something that needs continuous learning and adaptation.
No magic bullets.
Definitely not. The final message really seemed to be about taking ownership. Don't make excuses. Be proactive about your health. Keep learning.
Okay, so that's a lot we've unpacked from that conversation. Just to quickly recap.
Yeah, we covered a lot. The whole hormone optimization thing with TRT and peptides, especially for aging.
Right, then debunking those common fitness myths, stressing the personalized approach,
Uh-huh. The pretty pointed critique of Big Pharma's profit motives.
followed by the inspiring stuff from the Blue Zones diet community movement.
Then that interesting link between belief systems, purpose, and health.
And finally, her personal take, blending fundamentals with newer strategies and just taking ownership.
So connecting this all back to you, the listener, what's
Mm,
the through line? I think it really hammers home the need for personalization
absolutely. Questioning the blanket advice, thinking critically.
and looking at health holistically, right? It's
Mm.
not just diet or just exercise. It's community, mindset, purpose, understanding the systems around you.
Being informed empowers you. That's kind of the core idea, making better choices because you understand the landscape, Inger.
Couldn't agree more.
So, on that note, here's a final thought for you to chew on. Given everything they discussed, the questions about big pharma, the lessons from blue zones, the use of things like TRT and peptides,
Hmm.
what assumptions might you be holding about conventional healthcare? And are there maybe some avenues of personal health exploration, things discussed here, or even others that might be worth a closer look for you?
That's a great question. It prompts that self-reflection, doesn't it?
Mm.
Are you just following the standard path?
Right.
Or are you actively seeking out what truly optimizes your health based on good information and your own experience? Something
Yeah.
to think about.